To understand how a traumatic brain injury can impact an individual, it is necessary to understand what the brain actually does and how it works together with the whole body to regulate functioning. The brain does not only help formulate thoughts and emotions, but store memories, aid in learning, control conscious movement, and basically define who we are in this plane of existence. It is literally involved in nearly all processes from head to toe, and in turn, the body's processes help regulate the brain. It is a symbiotic relationship, and like any relationship, it can only be as good and healthy as the efforts both put into it. As a part of this design, there are numerous mechanisms that help keep our brain and body in balance and protected. If you have ever been injured, you have probably noticed that one of the most obvious consequences is inflammation. This occurs because the body responds by flooding the damaged region with compounds that dilate and increase the permeability of blood vessels to increase blood flow, discourage infections, potentially lessen pain, and aid in healing. If we are injured in the same area again before we are fully healed, or the injury is excessive and long-lasting, those processes designed to help us can actually become agents of additional harm. Some of those compounds that saturate the injury site can break down tissue if exposed for long periods of time. As a result, research has confirmed that chronic inflammation can be a contributing factor for cancer initiation and growth, and the development of numerous diseases. If the swelling continues to increase, with time, it could also lead to another injury from physical forces of the excess pressure. In addition, chronic inflammation can inhibit the natural homeostasis process, which can throw operations out of balance. When the injury is on the body, we can see and feel the results from that swelling. But what happens when the injury is within the confined space of the skull, where the brain does not have much room to expand? It adds another layer of possible injury to an already complex situation. The consequences of a brain injury depend on so many factors, including impact forces, what areas were damaged, if supporting structures were damaged, such as blood vessels, etc., if axons lost their ability to communicate with each other, if glands were damaged, and much more. When you add the element of swelling to the equation, it becomes clear why even a so-called mild traumatic brain injury can result in life-altering problems. The term mild can be misleading because it does not mean the outcome of the injury is mild. It is only a medical criterion that refers to a brain injury that did not result in loss of consciousness for over 30 minutes. Years of research have shown that there does not need to be unconsciousness to create serious repercussions, however. The swelling component of TBI can run the gamut of minor to so severe that human intervention is required to relieve the pressure before irreversible damage or death occurs. But even minor swelling can damage if it is chronic. Only 50 to 60 years ago, it was thought that a brain was only damaged if there was an obvious major visible injury, or there were substantial changes in motor functions. A lot has changed since then. With each new year of research comes new insights. The more we learn about what the brain does, the more we realize what can happen when it is injured. Due to the sometimes abnormal and aggressive responses of brain injury sufferers, a great deal of research is dedicated to the cognitive, behavioral, and emotional consequences. But research is finally proving what so many brain injury sufferers already knew. There are just as many physical consequences as there are mental and emotional. This is greatly helping with the identification of TBI so patients can receive more appropriate care and consideration. For the purposes of our search, there are basically 12 operating systems of the human body. They are the immune and lymphatic system, the digestive and excretory system, the respiratory system, the nervous system, the endocrine system, the exocrine system, the skeletal system, the muscular system, the integumentary system, the urinary and renal system, the circulatory and cardiovascular system, and the reproductive system. Every one of these systems has some kind of connection with the brain, either through communication and/or regulation. Depending on the location, severity, and repetitive nature of the brain injury, it can literally affect any or all of these systems. In the following episodes, we will examine a brain injury's potential impact on each of these systems.